Well, good day to everyone. This is Paul Irwin at the University of Tennessee, and I am very pleased to have the opportunity to make this presentation to the Academic Health Department learning community. The title of my presentation here is The Frequency and Characteristics of Academic Health Departments, but to stress, this is an exploratory study. I did not do this alone by any stretch. My co-authors include Patrick Barlow, who at the time was a PhD student here at the University of Tennessee and is now on faculty at the University of Iowa. Ross Brownson, who is on faculty at Washington University in St. Louis. And then our colleagues through the Academic Health Department learning community, Kathleen Amos and Dr. Bill Keck, without whom this survey couldn't have been conducted. And I should include right here that you, the Academic Health Department learning community, were the targets of the survey and participated throughout this study. So my thanks to all of you and my co-authors, and on behalf of them, I'm pleased to make this presentation. Here are our learning objectives today, so that by the end of the session, we're hoping that you will have a better understanding about just how widespread academic health departments have become, to describe the characteristics of academic health departments, and to identify the potential benefits of academic health departments. Now, I'll give just a little bit of background because this being the Academic Health Department learning community, I think it's a fairly safe assumption that most of you have some working knowledge of the concept of the Academic Health Department. But just to be sure, to get us all on the same page, I like to use Dr. Bill Keck's description of the Academic Health Department as the corollary of what the teaching hospital is to medical and nursing schools. We can't imagine a medical student becoming a physician just by being in the classroom. They are, in fact, very much involved in patient care in a teaching hospital, and there's often no apparent separation between that teaching hospital and the actual academic institution, but they are indeed two separate entities. Well, that's the way that we like to think of the Academic Health Department, as this merging of the relationships between an academic program in public health and the practice setting, a local or state health department, for example. There was a recent special issue on the Academic Health Department in the Journal of Public Health Management and Practice in May of this year. This is actually the third special issue focus on academic health departments and the relationship between academic programs and practice settings over the third special issue over the last 15 years. Almost all of what we know about academic health departments has come from what are mostly case studies. Even in this most recent special issue, almost all of the articles were describing single academic health department arrangements. However, the National Association of County and City Health Officials in their 2008 profile did include some general questions about local health department collaborative efforts and ask about the extent of those efforts with colleges and universities. But this is colleges and universities writ large. It's not specific to, for example, a public health academic program. So these were questions that were in the core questionnaire for the 2008 profile. And so you can see that of the roughly 2,000 responses, 88% of local health departments responded that they had some sort of partnership with a college or university, and that almost a third actually shared personnel or other resources. Now, in this same profile, the NACCHO also included a module that focused extensively on activities between academic programs and health department settings. And so you can see this slide, which is a busy slide, but contains, I think, some very important information. So local health department staff were asked about the degree or the extent to which local health department are involved with academic programs, and you can see that there are a number of specific questions down the left-hand column. But the questions were targeted by asking if, for example, local health departments staff serve as faculty with specifically accredited schools or programs, other four-year academic institutions, or two-year colleges. And one of the important take-home messages for me about this, about these data, are that local health department staff were very engaged with academic programs, regardless of whether or not they were specific to public health, or even whether or not they were four-year institutions. The extent to which local health department staff have been involved with community colleges, for example, I think is quite important, especially given the fact that most health departments are not in close geographic proximity to an accredited school or program. But other than this 2008 NACCHO profile that collected information from a group of people, if you will, again, most of what we know about academic health departments has been individual case studies. So what we're reporting on here today are the results of the survey that we conducted through the academic health department learning community. This was a web-based cross-sectional survey. We did have the survey undergo cognitive response testing with a small sample of practitioners and academicians who are familiar with the academic health department concept. But the survey link was sent out through the academic health department learning community to all of its members, and at the time there were 338 members. The survey questions targeted both the academic partner, the health department partner, and both. And we also included those same 2008 NACCHO profile questions that you saw on the previous slide. So on to our results. We had 110 valid responses from the 338 members for accrued response rate of 32.5%. However, I will point out that not all 338 members would have been expected to have or be in an academic health department relationship. For example, amongst the 338 members include members of national level organizations, public health or other type organizations that are not in an academic setting nor in a practice setting. So we estimate that the true response rate is probably closer to 50%. However, only 65 of the 110 respondents indicated that they were actually in an academic health department partnership. Recall that being a member of the academic health department learning community doesn't require one to actually be in an academic health department relationship. Of the 65 who responded that they were in an academic partnership, only 22 indicated that their primary appointment was in academia, and only 12 indicated that their primary appointment was in public health practice. So you can see right away why we're calling these preliminary results. We have small numbers to work with. But with what we do have, let me show you a few of the descriptive characteristics of these academic health departments. So among the 65, we were interested to see exactly how long these academic health department partnerships had been in existence. And we're actually quite surprised to see that almost a third had been in existence for over 10 years. For us, that suggests that there are great opportunities to learn something from these academic health departments that have been around for quite a long time. Here are some additional descriptive statistics. Again, the number responding changes to 34 because not all of the 65 respondents answered all of these questions. And for this set of characteristics, multiple responses were available. So that we see that out of the 34 responding to this set of questions, almost 3/4 had some sort of formal written partnership, with most of them having a memorandum of understanding or agreement. The vast majority had some sort of collaborative public health education or training that was established. We were interested to see that almost 2/3 had joint research projects. You can see also that 1/3 had shared personnel. Now, we ask a series of questions on the survey about the importance of perceived or expected benefits of an academic health department. And we also ask for the same potential benefit, the degree to which that benefit had actually been experienced by the academic health department partner who was responding. And so you can see for each of these items, we identify the percentage who responded that the benefit is very important, the percentage who then responded that the benefit is actually experienced to a large or very large degree, and then we showed the gap between the perceived importance and the degree to which the benefit had actually been experienced. So these items are listed by descending order of the benefit being very important, with the exception of that 3rd item. So you can see that 92% stated that improving the competencies of students thought that the benefit was very important, and 64% perceived or were actually experiencing this benefit to a large or very large degree. Then we drop down to improving the competencies of public health practitioners. And finally, that 3rd item, which was quite frankly unexpected, at least unexpected by me, improving the competencies of faculty, that almost half of the respondents thought this was a very important benefit, and 29% were actually experiencing this to a large or very large degree. So from our perspective, we think that these data are useful not only for showing which benefits are thought to be important, but also which benefits are actually being experienced, and then which of these benefits had the largest gap between those two. You can see that 5th item, increasing capacity for performing core public health functions, had the largest gap between perceived importance and actually experiencing the benefit. So for a summary of our findings, we thought that these were the most important take-home points. That 1/3 of the academic health departments have been in existence for over 10 years. Again, great opportunities to learn something from academic health departments that have been around the block, so to speak. almost 2/3 of the academic health departments are actively conducting joint research projects. So we think that this is incredibly important for stressing and emphasizing the notion that academic health departments are not just opportunities for students to do internships, that real practice-based original research is being conducted and published in peer-reviewed journals. A third element that we thought was extremely important is that engagement between public health practitioners and academic health departments is not just limited to accredited schools or programs in public health. You recall the module questions from the NACHO profile and the responses that came back from accredited schools, other four-year institutions, and then two-year schools. Again, we ask those same questions on this survey. Unfortunately, as mentioned earlier, we only had 12 responses from public health practitioners for these questions. But nevertheless, among the 12 who did respond, most responded that they were engaged with all sorts of academic programs. And then finally, we think that this is an important take-home point, as I alluded to earlier, that beyond the value that academic health departments bring to improving the competencies of students and public health practitioners, they're also valuable for improving the competencies of faculty. Now, there are a number of limitations, as you might well imagine, to the study. First and foremost is that we had a small sample size for some subgroups that limited both the analysis and interpretation. A second limitation is not only the relatively low response rate, but actually uncertainty in being able to determine a denominator for calculating the true response rate. There's always the possibility that there's selection bias because members of the academic health department learning community may be different in their attitudes about academic practice linkages than non-members. There may have been duplicate answers. For example, there may have been responses from both the academic and practice partners within the same academic health department relationship. We had no way of being able to identify that. And then finally, data were self-reported and there was no attempt to verify the accuracy of the data. Our next steps include exploring better methods to document the prevalence of academic health departments. We're already working to see how we might duplicate this survey with another group, whether it's practitioners or academicians. We're looking for opportunities to repeat those questions from the 2008 NACHO profile. And then finally, we're using this as a springboard for the initial efforts to develop a research agenda for the academic health department. So here are some references that may be of use to you if you're interested in diving deeper into the academic health department. And so here are our questions for discussion that we would be interested in entertaining for the rest of the webinar. So thank you very much again for this opportunity, and I bid you good day.